Welcome back to the Pat and Aaron Show, and time for our injury report presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And we love having Dr. Jeff Sellman on the show, and always an important conversation. But with the Buccaneers playing Monday night against the Eagles and both teams dealing with injuries to the quarterbacks, a very important injury report today. Good morning, Dr. Sellman. How you been?
I've been great, man. How you been?
We're doing better than Baker Mayfield's ribs and ankle, I'll tell you that. And let's look at that. Let's take a look first at the ankle of Baker Mayfield, who he injured that early in the game last week, and then we'll get into the rib injury that he suffered a couple weeks back and was still hampered by it last week. But starting with the ankle injury with Baker, what are we looking at here, and what kind of impact could that have Monday night?
You know, it looks like we're looking at a typical ankle sprain that involves the outside ligaments of the ankle, kind of the inversion injury that we all get. It has a lot of swelling, decreased range of motion. So what we could look for is, fewer steps, drop back, maybe a little bit less scrambling around the pocket. But usually, especially at the NFL level, when you get an ankle injury like this, they've got all hands on deck and able to get him back pretty quickly.
Dr. Sellman, we were talking about it earlier in the show. Baker was 0 for 8 on balls that traveled more than 10 yards in the air this past Sunday. Do you think, and he just looked off, and I believe, we don't know, but I believe it had something to do with his injuries. When you see a quarterback who is maybe a little bit off, maybe a little bit inaccurate with his throwing, in your opinion, is that more likely about the ankle, or is that more likely about his ribs?
You know what? From the experience with the ribs, I'm going to go with the ribs 100%. And I hate it when my balls don't go more than 10 yards too. But yes, the ribs are what causes a lot of issues.
Yeah, because we're looking at Baker Mayfield, and sometimes when he gets injured over his pass, it seems like the production has gone down. What is the treatment going to be like? I mean, obviously it's going to get better each and every day, but what's that treatment plan like for a guy like Baker Mayfield when it comes to those ribs?
Yeah, those ribs. You know what I tell my patients is really the best thing to do for ribs is put barbecue sauce on it, to be perfectly honest, because it's just so freaking hard to take care of those bad boys. It's anti-inflammatory, it's ice, it could be a binder, more protection. The issue, though, is that a lot of times I will give my patients an inhaler, kind of like the asthmatics get, so that you can open up your lungs. Because every time you take a breath, it's a lot of pain, and you're just, we as humans like to breathe a little bit, right? So he's going to be going through some exercises with maybe some deep breathing, some short coughing and that kind of thing to help any kind of buildup in the lungs themselves, because we forget that when we don't take deep breaths, it could set us up for something else like pneumonia.
So Jalen Hurts, he's obviously coming into this game a little banged up as well. He says that the right middle finger on his throwing hand simply, quote unquote, popped out. Is that just a dislocation? Like, I've never had any of my stuff just pop out. I don't know if it's painful, but it sounds a lot more painful. But most importantly, doctor, let's just say it did, quote unquote, pop out. How likely is something like that to happen again, to get re-injured if he hits it on a helmet or something like that? Is it something that once you pop it back in, it's good? Or is it the type of thing that he's got to watch out for and it could happen again?
Well, yes and no. Once you pop it back in, if it indeed was out, you actually get significant amount of relief, but the amount of swelling will decrease your kind of range of motion, your ability to use that finger, which is kind of important for a quarterback. But when you look at his injury, the defender's hand basically jammed his middle finger, and it caused what's called a swan neck deformity, which could be a dislocation, a result of a dislocation, could be a result of a fracture. It could just be a result of some stretching of the ligaments on the top part of our finger, causing that middle knuckle to go up and the tip of our finger to go down. So basically, it's just wrap that bad boy up and see if he can't throw a little bit better. But they are going to have to give him some limitations as well.
Oh, we love that. We love, as Buccaneers fans, to hear about limitations to the Eagles quarterback, Jalen Hurts. Let's say my finger, Dr. Sellman, happened to pop out of place. I want a tutorial. My finger pops out of place here, and I need Pat to pop it back into place. What would that?
And that's where you've gone wrong. You go to Dr. Sellman, not me.
I need a quick relief before, but what would they look like?
Well, first of all, your prayer. Yeah. And second of all, you look away while for instance, Pat will take your middle finger now and pull it. Now, don't pull your finger and do other things, because that's one thing I don't want to have in my face. But traction on that finger until it literally pops back into place. You don't yank it. You just gradually pull it toward or away from your body until it pops back into place. And it's like a big sigh of relief.
Yeah, I'll just call you.
Yeah,
good job.
I would definitely not do that.
Just keep your finger out of the dark places that you normally can stick it.
Let's say it was something else. If there's some ligament damage in that hand or something like that, could you see that being something that really impacts the game on Monday night? Or should we believe Jalen Hurts and the Eagles that he should be fine? Because we don't want guys to get hurt, especially seriously, but we wouldn't mind his finger being an issue on Monday night.
We wouldn't mind the quarterback having a little limitations at all. So maybe, don't quote me, I don't know, but they may decrease his deep passes and limit him to more short passes, screens, and, of course, running the football.
There you go. Expert advice from Dr. Sellman. You are the best, Dr. Sellman. We love having you on, and we love our Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute, providing you access to one of the top orthopedic programs in the nation. Schedule your appointment today. Do not wait. Schedule it today at floridaortho.com. Dr. Sellman, we really do love having you on. We hope you have a great rest of the week here.
Love you guys. Appreciate it.
Thanks, Doc. Love you, too.